Hi friends, once again good evening and welcome to my channel Mukambika Nursing. Friends, here we are discussing questions for ESIC Nursing Officer exam preparation. Also these questions will helpful for your other Nursing Officer exam preparation. ESIC exam is on 7th July. We can see today's question. First question, which of the following anti-tubercular drug causes red-orange discoloration of urine? Options, option A isoniazid, option B rifampicin, option C ethambutol, option D streptomycin. Here are question, which anti-tubercular drug causes red-orange discoloration in urine? And it is rifampicin. Option B is the correct answer. Rifampicin is one of the first-line anti-tubercular drug and the main side effects include heartburn, nausea, vomiting, diarrhea, then red-orange colored body secretions. Here red-orange color of urine and vision changes, then hepatotoxicity, hepatitis, then increased uric acid level, then blood dyskaryosis and hypersensitivity reactions include fever, chills, shivering, headache, muscle and bony pain and dyspnea. All the side effect of rifampicin, and this rifampicin decreases the effect of some other medications. If the patient is taking this all medication, this rifampicin decreases the effect. The medication, what are the medications? We can see first one oral anticoagulants, second one oral hypoglycemic agent, and next one chloramphenicol, and next one digoxin, then fluconazole, then methadone hydrochloride, phenytoin, verapamil hydrochloride. These are all the drugs. Suppose if the patient is taking this drug along with rifampicin, means the rifampicin will decreases the effect of these medications. Move on to the next question. The anti-tubercular drugs that has potential for damaging 8th cranial nerve is. Options, option A isoniazid, option B rifampicin, option C ethambutol, option D streptomycin. Question, which anti-tubercular drug can cause damage to 8th cranial nerve? It is streptomycin. Option D is the correct answer. Streptomycin is an example of aminoglycoside antibiotic which is used in the treatment of TB, and this is contraindicated in case of hypersensitivity, myasthenia gravis and Parkinson's disease. Also this is not given in case of 8th cranial nerve damage. Also this streptomycin can cause CNS depression, so it should be given with caution in case of older clients, neonate and also young infants, because this medication can cross the central nervous system, and this also cause renal insufficiency and immaturity. Okay, streptomycin can cause renal insufficiency and immaturity. And the next question, which of the following drug causes grey baby syndrome? Options, option A chloramphenicol, option B kanamycin, option C gentamicin, option D penicillin. Which drug causes grey baby syndrome? Grey baby syndrome is associated with chloramphenicol. Option A is the correct answer. Move on to the next question. Anticoagulants present in hemogram vial is. Options, option A EDTA, option B heparin, option C sodium chloride, option D sodium citrate. Which anticoagulant is used in hemogram vial? It is EDTA. Option A is the correct answer. Hemogram vial is EDTA vial. And the next question, hospital acquired infection referred as an infections occurred after dash hours of admission. Options, option A 12 hours, option B 24 hours, option C 48 hours and option D 1 week. Question, in hospital acquired infections means infection occurred within or after dash how many hours of admission? After 48 hours of admission. Option C is the correct answer. And the next question, antibodies are produced by options. Option A, plasma cells. Option B, lymphocytes. Option C, basophils. Option D, erythrocytes. Are antibodies which are produced by lymphocytes. Option B is the correct answer. And the next question, major constituents of bone is options. Option A, calcium sulfate. Option B, calcium phosphate. Option C, sodium chloride. Option D, magnesium sulfate. Question, which component is present major component in the bone, or it is present more in bone? Usually bone contain calcium. The calcium phosphate. Correct answer is calcium phosphate. The major constituent of bone is calcium phosphate. And the next question, lifespan of platelet is options. Option 90 to 120 days. Option B 1 to 3 days. Option C 8 to 12 days. Option D 1 day. Lifespan of platelet. It is usually the lifespan of platelet is 7 to 10 days. But in our option, nearby date is there, that is 8 to 12 days. So that is the correct answer. This is one of the previous year question. So option 8 to 12 days. It is option C is correct. And the lifespan of RBC is 120 days. And the next question, which vaccine stored at the freezer compartment of a refrigerator? Options, option A, OPV, option B, MMR, option C, BCG, option D, measles. Our question, among this, which vaccine is stored at freezer compartment of refrigerators? It is oral polio vaccine. Non-stabilized oral polio vaccine is stored at minus 20 degrees Celsius in deep freezer. Okay, it is stored at minus 20 degrees Celsius. Last option, measles. Measles vaccine is stored at 2 to 8 degrees Celsius, and BCG vaccine which is stored at below 10 degrees Celsius. Move on to the next question. The route of administration of BCG vaccine is options. Option A, intramuscular. Option B, intradermal. Option C, intrathecal. Option D, subcutaneous. Route of BCG vaccine. And the correct answer is it is intradermal. BCG full form is Bacilli galmiti-gueri. Okay, this vaccine, BCG vaccine, is given intradermally. If the newborn age is below 4 weeks, means the dose is 0.05 ml. And the next question, schizophrenia comes under which type of psychological disorder? Options, option A, neurogenic disorder. Option B, bipolar disorder. Option C, psychotic disorder. Option D, depressive disorder. Schizophrenia comes under psychotic disorder. Option C is the correct answer. And the next question, which mood disorder include the occurrence of depressive episodes and one or more elated mood episode? Options, option A, neurogenic disorder. Option B, bipolar disorder. Option C, psychotic disorder. Option D, depressive disorder. The question itself, it is there, it is one of the mood disorder. Okay, so mood disorder with depressive episode and one or more elated mood episode. It is bipolar disorder. Option B is the correct answer. Move on to the next question. Incubation period of Staphylococcus food poisoning is? And the options, option A, 4 to 6 hours. Option B, 6 to 12 hours. Option C, 12 to 18 hours. Option D, 18 to 24 hours. Question, what is the incubation period of Staphylococcus food poisoning? It is 4 to 6 hours. Option A is the correct answer. Move on to the next question. In blood culture, the blood to reagent ratio is? Options, option A, 1:2. Option B, 1:5. Option C, 1:10. Option D, 1:15. In blood culture studies, blood and blood to reagent ratio is 1:10. Option C is the correct answer. Move on to the next question. Which among the following signs can be seen in intrauterine fetal demise? Options. Option A, Gould sign. Option B, Chadwick sign. Option C, Robert sign. Option D, Trouser sign. Question. Which among the following signs indicate intrauterine fetal demise or intrauterine fetal death or stillbirth? That means the fetus dies within the uterus. Okay, before delivery. Here the correct answer is option C, a Robert sign. Robert sign indicate the presence of gas shadow within the heart or great vessels that indicate intrauterine fetal demise or intrauterine fetal death. It can be usually seen 1 to 2 days after the death of the baby. Okay, that is the Robert sign. Option, Gould sign. Gould sign is the softening of the cervix. Cervix becomes soft. It is usually seen in the first trimester, that is earliest 6th week of pregnancy. And second option, Chadwick sign. It is also known as Jacquemus sign, and it is the dusky hue of the vestibule and anterior vaginal wall, usually visible at 8th week of pregnancy. And last option, Trouser sign. It is one of the positive sign of hypocalcemia. Trouser sign and Chopstick sign are the positive sign of hypocalcemia. Move on to the next question. Which drug consumption by pregnant lady can lead to baby developing Epstein anomaly? Options. Option A, steroids. Option B, erythromycin. Option C, lithium. Option D, warfarin. So here are question. Which drug consumption of the mother during the time of pregnancy can cause Epstein anomaly in babies? And the correct answer is, it is lithium. Okay, option C is the correct answer. First option, steroids. Consumption of steroids in antenatal period may cause cleft lip and cleft palate to babies. And erythromycin, second option, which may cause infantile hypertrophic pyloric stenosis to babies. And last option, warfarin, which may cause nasal hypoplasia. Move on to the next question. Which among the following tests is used to evaluate neonatal maturity? Options. Option A, square window sign. Option B, scarf sign. Option C, capillary refill time. Option D, all of this. Our question is, which test is used to evaluate neonatal maturity? And the correct answer is option A, square window sign. This is one of the component of New Ballard scoring. This is done. Square window test is usually done to evaluate neonatal maturity. Second option, scarf test. This is also one of the newborn assessment, which is usually done the infant born before 30. The usually preterm infant which is born before 30 week of gestation. In this assessment test, usually find out the preterm infant's elbow crosses the body midline without any air assistant. Okay, that is scarf sign or scarf test. Capillary refill time means it is the time taken to regain the capillary bed after pressing the capillary area or after pressing the nail bed. The time period to be normal, that is capillary refill time. A prolonged capillary refill time is one of the sign of circulatory shock. Move on to the next question. The dose of anti-D for antenatal prophylaxis in Rh negative mother is? Options. Option A, single dose of 1000 IU at 28th week. Option B, single dose of 1500 international unit at 28th weeks. Option C, single dose of 500 international unit at 28th week. Option D, single dose of 100 international unit at 28th week. Here our question is, the dose of anti-D injection for antenatal prophylaxis, that is before delivery in Rh negative mother is? The dose is single dose of 1500 international unit at 28th weeks of pregnancy. Okay, before delivery, that is antenatal period, the prophylaxis dose for anti-D injection is 1500, single dose of 1500 international unit at 28th week of pregnancy. And the postpartum prophylaxis in Rh negative mother, that is postpartum means after delivery, the dose of injection, anti-D injection is 300 micrograms following delivery. Okay, the dose is 300 micrograms and the route of administration is IM, intramuscular, and it should be administered 72 hours or earlier following delivery. And in case of spontaneous abortion or induced abortion or ectopic pregnancy, the dose of anti-D injection is 50 micrograms. Okay, after delivery 300 micrograms, and in case of abortion it is 50 micrograms. Move on to the next question. The causative organism is present in the environment but there is no transmission is known as. Options: option A control, option B eradication, option C elimination, option D removal. Your question is, the causative organism of the particular disease is present in the environment but there is no transmission to peoples. That is known as elimination. Option C is the correct answer. And the second option, disease eradication, means complete elimination of the causative organism. And control means controlling the organism by using measures. Control measures. Here answer is elimination. Move on to the next question. A nurse is reviewing the client's plan of care. What is the determining factor in the revision of the plan? Options: option A time available for the care, option B validity of the problem, option C effectiveness of the intervention, option D method of providing care. Here the question is, a nurse is reviewing or rechecking the client plan of care. What is the determining factor in the revision of the plan? So why she is mainly revising the plan of care? What is the benefits of revising this plan of care? It is to identify the effectiveness of the intervention. Option C is the correct answer. If the nurse is not implementing the plan of care properly, then the outcome will not be good. Okay, so she should review or revise the plan of care and do properly, then the outcome of the intervention will be good. So here effectiveness of the intervention is the correct answer. Move on to the next question. A nurse is caring for a client with hemiplegia who is frustrated. How can the nurse motivate the client towards independence? Options: option A establish long range goals, option B identify errors that the client can occur, option C reinforce success in task accomplished, option D all of this. Here the question is, a nurse is caring a hemiplegic patient. The patient is frustrated because of his hemiplegia. Hemiplegia means paralysis of one side of the body. So in this situation, how the nurse can motivate the client, okay, to the independence, towards the independence. Okay, you can do it properly, or you can do your work by own, you can maintain all by independently. Okay, how she can or he can motivate the patient? By reinforce the success in task accomplished. Option C will come correct over here. First option, establish long range of goals. If we are setting long goals, it will not motivate the client. Okay, identify the errors that client can occur. Errors, we should not, as a nurse, we should not focus on the errors. We have to reinforce the success. Yeah, you can do, you will doing better. So reinforce the success in task accomplished. Option C is the correct answer. Move on to the next question. Which among the following activities compromised in a newborn baby with cleft lip? Options: option A sucking, option B swallowing, option C respiration, option D facial expression. Here the question, which activity will be limited in case of newborn baby with cleft lip? And the correct answer is, it is sucking. Option A is the correct answer. And the next question, cyanosis in a child can be seen in all the places mentioned below except. Options, option is sclera, option B tongue, option C nail bud, option D lips. Here the question is cyanosis in child or children. Cyanosis means bluish discoloration of the body. So the cyanosis in children can be seen in all places. But one place we can't easily identify the cyanosis. That is sclera. So here sclera, easily we cannot identify cyanosis in sclera. Option A is the correct answer. Friends, today we discuss questions from previous question papers and also important questions. Surely these questions and important points will helpful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle.